I work with Celia for
Earlier this year in the U.S. state of Missouri, family and colleagues held a vigil to remember Philippines-born Celia Yap Banago, who was just days away from celebrating 40 years working as a nurse.
You would dedicate your entire life to helping others.
Celia's son has said she wasn't supplied appropriate PPE and became infected after treating a COVID-19 patient.
We hoped that she would be coming back with us, but she didn't make it.
In California, in July, colleagues gathered to remember Filipino-American Janine Pasty Ponder.
Janine is important.
National Nurses United says Janine died just days after she ran after 2 COVID-19 patients who wandered out of their rooms. Janine had been supplied with only a surgical mask, as opposed to a more protective N95 mask. Longtime friend and colleague Sherry Emery Klein says patients and doctors loved Janine because they knew they could always count on her.
Janine was the kind of nurse you want to have at the bedside. She was able to build a rapport with patients and establish, their trust. I miss that little spitfire of a woman, just tenacious and so dedicated and so on it.
And this is Ultimate Summit Medical Center, the place where Janine worked and cared for patients. Unfortunately, she's become part of some startling statistics. While Filipinos make up 4% of the registered nurses in the United States, they account for about 32% of the registered nurses who've died of COVID-19.
We tend to work in medical, surgical areas and critical care. Filipino American nurses are in the hub of where all these COVID positive patients are being cared for.
Born and raised in the Philippines, Cortez says Filipino American nurses tend to work long hours, with some obligated to send money to relatives in the Philippines. A sense of responsibility in a number of ways likely increases their risk.
Due to lack of staff, Filipino American nurses tend to not leave the other co-workers shorthanded, and so they would volunteer to stay over because culturally, we treat our patients as if they're family. Also, in some cases, the Filipino nurse has been recruited from the Philippines, and part of that thinking is that they owe their employer something. A lot of them would not speak up or question their manager.
Cortez's group continues to push the government to increase PPE production and hospitals to increase distribution. She says nurses often have to reuse old masks because they're heavily scrutinized when asking for new ones. She also says many Filipino American nurses live in multi-generational homes, so when they're put at greater risk, their families are too. Mark New, CGTN, Oakland, California.